Hi everybody. A few days ago I posted something about one of my experiences as a registered nurse and not a nurse practitioner. And I'm going to tell you another story, and this is from when I was a very little baby nurse, just graduated, and I was working on a medical floor, which are very heavy floors if you don't know. But this particular night, one of my patients was up and about. She was a fairly young woman, and I think if I remember, she was there for some kind of testing. She did not sleep. It was very hard because you run around with your colleagues and you get all of the work done and all the medications done and all the patients prepped for the night and settled. And then you might have a bit of a chance to have a break. You might. You don't always. Anyway, this woman was everywhere. I can't sleep. I can't sleep. I gave her medication and tried other things, and they did not work. And when I got to our break time around 2 o'clock in the morning, everybody was a little bit frustrated with her because, she was interrupting our very precious break time. And then I had an idea. I had been to a conference, not long before that. And I don't remember anything about the conference except someone was talking about and demonstrating therapeutic touch. And I thought, oh my goodness. I mean, it's the first time I'd ever seen anything like that. They didn't even touch the patient. They talked about swooshing auras and stuff away. And I thought, oh my goodness, this is very much too woo-woo for me. But it did intrigue me. Anyway, I said to the woman, come on, I'm going to do something. And you're going to go right to sleep. So I told her that what I was going to do was like whoosh the bad stuff away, whatever thoughts she was having or was preventing her from sleeping. And I wasn't even going to touch her, swooshing away. And she was asleep, like sound asleep in less than a minute. And so I walked out. Dun, dun, dun. First thing my colleague said to me was, what did you do? Did you kill her? Oh no. Yeah, but I explained what I did, and they were kind of confused and astounded. And you know something? So not only did it work, but it gave me a whole new respect for other modalities. And since then, I've learned acupuncture, and pretty soon I'm going to learn clinical hypnosis. The other thing I want to say is, if you're in hospital or you have family in hospital, be nice. Those nurses are working hard. And if they're sitting at the desk, it is not because they're not doing nothing. They're probably having a well-deserved break. Anyway, that's my story.